This is Brian Stewart from Dickson-Diveley Orthopedics, and today we're here for another installment of Get to Know Your Ortho. And today I'm excited to have Dr. Nick Ting with me to talk about himself and his practice and to have an opportunity to get to know him a little bit better. Dr. Ting, how are you this morning?
Great, Brian. Thanks for having me.
Let's jump into it. I want to know first a little bit about your background. Where'd you go to school and how'd you come to Dickson-Diveley Orthopedics?
So I moved to the Midwest when I was 18 for college. I went to college at the University of Chicago. I was a double major in biology and economics, worked for a few years thereafter in business, and then wound up going to medical school in Chicago because I met my wife there at Loyola. Thereafter, I went to the Cleveland Clinic in Cleveland, Ohio for residency, and then I did my fellowship in hip and knee replacements at Ortho Carolina in Charlotte, North Carolina. What brought me to Dickson-Diveley ultimately was I went to practice initially at a major academic medical center in Chicago and enjoyed it, but for family reasons, wound up relocating here to Kansas City. And joined Dickson-Diveley because it's a phenomenal place to practice, combining both the intimacy of a private practice setting, but still with some teaching privileges with the residency at UMKC. So that's what brings me here.
Perfect. You mentioned that hip and knee are kind of your specialty. And in fact, I think joint replacement would be your specialty. Do you want to tell folks a little bit about some of the technology that you utilized in performing hip and knee replacements?
Sure. So one of the things, as far as technology goes, I think it's an exciting field because it is constantly evolving. One of the things that we are really proud and enthusiastic about introducing to patients is robotics as far as hip and knee replacements go. So we use the Stryker Mako plasty system for hip and knee replacements, and combined with, the techniques that we use in knee replacements, as well as for me, a direct anterior approach to the hip. It's really kind of been a phenomenal sort of marriage of traditional but new cutting edge techniques to patient care.
Perfect. You said you met your wife in college. You want to tell folks a little bit about your family?
Yeah, so I am happily married to my wife, Felicia, who is a practicing veterinarian. I've got two awesome kids who right now don't love sleeping all that much. So I've got a 4-year-old daughter and a 2-year-old son. So they keep me pretty busy outside of the OR in the office.
Perfect. Well, the background in business might help you manage. I don't know that there's anything that helps you manage that. Are you ready for the fast 3 questions where we get to know you a little bit better?
I am.
Perfect. Now, obviously, you're a guy that believes in working out. I mean, we've all seen the gun show that is Dr. Ting. But what's your favorite workout to do, or what's your favorite exercise to do if you go to the gym?
So I am a big fan of weight training. Now, that has changed a lot since we are in the new reality of now in social distancing. So I haven't been in a gym setting since all of this has happened to us. So a lot of it now are just resistance bands at home and stationary bicycling, and honestly going out for long walks with my wife and kids every chance we get. So that's kind of what's keeping me fit and active, I think, now.
We're all learning how to modify, I think, during this time. Question number 2. Are there any TV programs that you're absolutely binge watching at this point in our current cycle?
So I'm a big fan, honestly, of period type pieces. And so I was certainly a big Game of Thrones fan, but that was, I've seen the entirety of that series probably 3 times over pre-COVID. And so the ones that I have been binge watching as of lately are one, it's on the History Channel, it's Vikings, the series, and then the other one is a spoof on Netflix called Norseman, which is just a spoof really on Vikings.
I'll take it. I like the period piece avenue there. Last question for you. Who's your favorite superhero and why?
My favorite superhero would have to be Wolverine. As far as why, so the guy's got metal in his bones and he heals well, both of which I feel like are just qualities that I value, I guess. I mean, strange, but yeah.
It's sort of ironic. It's kind of a natural fit for what you do. That works great. Works great. I know you also have at least two folks that help you in your practice, Kim and Sarah. Didn't know if you wanted to mention them at all during this.
Yeah, so I'm going to see if they can.
Oh yeah.
So yeah, that's the team right there. So they are really sort of, for all intents and purposes, and rightfully so, a better face to the practice than I am. And really, really kind of hold it down and manage on the day-to-day basis. I couldn't do what I do without their help. And, I think, especially with joint replacement, I think it's not just a procedure. I mean, it really is, it's a really sort of lifelong relationship that I like to sort of build with patients, because when you do an implant in a patient, I think, my philosophy has always been you see it all the way through for a lifetime of all of it. And so, implicit in that is a long-term relationship, but often as my schedule pulls me in multiple directions, I need a great team to sort of be the face of that and help sort of manage a lot of the day-to-day stuff and answer questions whenever they come up. So, and they are invaluable at helping with that.
I know how great your team is, and I'm glad that you had the opportunity to talk about them and what they do to make things run smoothly, not only for you, but for your patients. That's been Get to Know Your Ortho with Dr. Nick Ting. Tune in next month when we'll get to know another orthopedic surgeon. Have a great day. Thanks.